from Dr. Sulaiman and Habib are here to provide you a video presentation on how to do the proper donning and doffing of PPE and on how to do the proper wearing and removing and cleaning of the PAPR or the powered air purifying respirator for those people or healthcare workers who are not fit to wear the N95 mask. First, we will start with hand hygiene. When we talk about hand hygiene, we have two types, hand rub and hand wash. The one that Miss Rose is demonstrating to you is what we call hand rub. When you're doing the hand rub, it will take only 20 to 30 seconds to perform the procedure. You start with right palm over left dorsal finger interlace, palm to palm finger interlace, interlock, thumb rotation, and back of the fingers. I will share you a technique on how you're going to remember the steps for donning. The sequence will be going up. You will start with hand hygiene, gown, mask, face shield or goggles, and last will be the gloves. Because we want the gloves to be the cleanest part of the PPE before we touch the patient. Next, I'm going to proceed and show to you how to do the proper donning. After doing the hand hygiene, the next step will be you're going to wear the disposable gown. When you wear the disposable gown, always secure the upper strap first before the lower strap. How you're going to secure the upper strap? By using the ribbon method. Secure the upper strap first using the ribbon method. And then make sure that your entire back is covered by the gown by overlapping one part of the gown to the other side. And then secure the lower strap. Everything should be tied at the back. Nothing is allowed to be tied at the front or on the sides. Because later on, if you're going to do the doffing, you're not allowed to touch the front portion of all your PPE. If you have a colleague with you who is fat, who is big, that person will require two gowns. First gown tie at the front, second gown tie at the back. Next, after the gown would be the surgical mask. For the surgical mask, we have two sides, okay? The colored part, sometimes it comes in blue color or in green color. Okay. The colored part of the mask is the one outside and the white part is the one inside. The colored part of the surgical mask is the water repellent side of the mask. That's why this is the one outside. And the white part is the air filter. This is the one inside. The water repellent side should be outside in order to protect the healthcare worker from any secretions from the patient. If you're doing CPR, suctioning, the healthcare worker is protected. And the air filter is actually enough to filter the air or respiration and protect the patient from any infection in case the healthcare worker is sick. After putting the mask, use your two fingers and secure the metal nose piece. Next would be the face shield or it could be the goggles. Next will be the gloves. We want to be the gloves to be the last part of the PPE because we want this to be the cleanest part of the PPE before we touch the patient. Make sure when you wear your gloves that your entire hand is covered by the gown and the gloves. So this is what you call donning, proper wearing of PPE. You start with hand hygiene, gown, mask, face shield or goggles, and last is the gloves. Now we are going to proceed with the doffing. When we talk about doffing, this is the proper removal of all PPE. In order for you to remember the sequence will be going down. Put your hands like this, the sequence will be going down. When you're doing donning or removal of PPE, the first step that you're going to do is remove the gloves because the gloves is the dirtiest part of the PPE after touching the patient. When you remove the gloves, use the glove to glove, skin to skin technique. Glove to glove, glove to glove, outside to outside, and keep it in one hand. Then using your two fingers, insert it inside the gloves, and remove the other glove. This is what we call glove to glove, skin to skin technique. After removing the gloves, you need to perform hand hygiene again. After doing the hand hygiene, the next step would be going down. It will be the face shield. Remember, when you are doing doffing, you're not allowed to touch the front portion of the PPE because this is considered contaminated. So you're going to remove your face shield from the back. And put it in a container or discard it because this is single use. Okay? The next step will be the gown. Okay? When you remove your gown, remove the lower strap first. Do it slowly. And the upper strap. This is to prevent the gown from dangling down and contaminating your uniform. When you are not that expert yet, do the process slowly. This is to prevent production of any droplets that you can inhale and contaminate yourself. Remove the gown from inside using your one hand on the opposite side. And the other on the other end. And then slowly roll it away from you. Make it in a small bundle before you're going to discard it in the medical waste. The 3 PPEs, the gloves, gown, face shield or goggles are being removed when you are inside the isolation room or when you are inside the patient room. The mask will be removed once you step out of the isolation room, once you proceed to the anteroom or outside of the patient room. In the room, I'm going to remove my mask. When I remove my mask, same like what you did in the gown, remove the lower strap first, then lift it a little up like this, and then the upper strap. Making sure that you're not going to hold the mask itself because this is also considered contaminated. And everything should be discarded in the medical waste. After removing the mask, you need to do hand hygiene again or removal of PPE. We start from the sequence going down. You start removing gloves and do hand hygiene. After that would be the goggles or the face shield, and then going down would be the gown or the disposable gown. You need to do hand hygiene again. I hope that after watching our short video presentation on how to do the proper donning and doffing, you learned something about it. Make sure that you practice within the standards and follow as recommended by the infection control.